Hello everyone. So, yesterday we discussed about GIT, cardiovascular system, central nervous system and many more. So, among all those, we learnt about some of the most important questions. We learnt about some of the most important topics also, right? Now, among all these, my dear students, I need you to understand some of the aspects. What are those? అట్లా సీన్ చేంజ్ చేయండి. అది సీన్ చేంజ్ చేయండి. అక్కడ ఇంట్రో సీన్ ఉంది కదా, ఇంట్రో సీన్ నుంచి మెయిన్ సీన్ క్లిక్ చేయండి. ఫుల్ స్క్రీన్ కాదు, మెయిన్ సీన్ క్లిక్ చేయండి. లేదు మెయిన్ సీన్ క్లిక్ చేయండి. మెయిన్ సీన్ చేంజ్ అయినా ఉందా? అబ్బా, now it is come. So guys, let's see. There is some connectivity issues. We are trying to resolve it meanwhile. Okay. So guys, yesterday we discussed about a lot of things. What are those? GIT, CVS, right? CNS. So among all of these things, we discussed about some of the interesting topics. Those interesting topics being included as anti-epileptic drugs, antihypertensive drugs. So everywhere, I told you people some of the important concepts which have to be remembered. Okay, so please make sure that you learn those topics. Without those topics, it will be very difficult for you to go through the exam. Okay, so with that much being said, hope I'm audible for everyone. Am I audible? Can you give me some response, please? So guys, I want you to do one thing. Just directly go to the live point and just forward the video and watch. So can you hear me, guys? Can you give me some response? Good afternoon. Okay, perfect. So guys, now whenever you get a doubt, please drop it in the comment section. Please drop it in the comment section. No problem. I'll clarify it. Okay. Now let's start, right? So yesterday I told that we will be doing the other systems as well. What are the other systems? Very good. Let's start with the most important system called as endocrine system. What is that? Endocrine system. Now endocrine system, before going to endocrine system, from yesterday, whatever I taught you people, I will do a quick review of some points, some 6 to 7 points. You need to remember all those 6 to 7 points. There can be 2 MCQs from here only, especially from the topic of hypertensive, antihypertensive drugs. So what are those things? I told you people what is the drug of choice for a patient with BPH and hypertension, alpha blockers. A patient who is having diabetes mellitus and hypertension, drug of choice is the AC inhibitor. A patient who is having diabetes mellitus and diabetic nephropathy, again drug of choice is AC inhibitor. Now for example, we talked about a patient who is having what is that, gout and hypertension, then we are preferring the drug as losartan, right? Which drug is not given in a patient with gout? That is thiazide diuretics. Okay, now let's start with the endocrine system. So when you want to learn the endocrine system, we have one organ called as hypothalamus. Hypothalamus. Now this hypothalamus will release some hormones which will control the regulation of pituitary gland. Okay. Now listen to me very carefully. Hypothalamus will stimulate the hormones, will release the hormones which will go and stimulate the pituitary. Now when you look at a pituitary gland, now before going into pituitary gland, let's understand the basics of the pituitary gland. So when you look at a pituitary gland, Pituitary gland. Now, how does a pituitary would look something like this approximately? So, pituitary gland would be divided into two divisions, majorly two divisions, but when we are speaking anatomically or histologically, we divide it into three divisions: anterior pituitary, intermediate, and posterior. But overall, you need to remember anterior pituitary, and there is something called as posterior pituitary, right? Now, when we need to understand about anterior and posterior pituitary, see, hypothalamus majorly regulates your anterior pituitary, guys. Majorly regulates your which pituitary? Anterior pituitary gland. But when you look here, posterior pituitary, this is a little bit different story. Let's start with that different story itself, right? Now, understand the first and most important aspect. So, posterior pituitary will store some hormones. Which are those hormones? Posterior pituitary will store some hormones. Which are those hormones? Those posterior pituitary hormones are, stored hormones are your vasopressin, and there is one more hormone, that is your oxytocin. Now, when we look at a pharmacological point of view, we have a different approach here. See, I'm not going to get into the physiology since it is a quick review session. So, I'm going to teach you people some important aspects from the pharma side. Okay. Now, let's start with the vasopressin. Normally, vasopressin is also known as also known as, what is that? That is your ADH, that is your antidiuretic hormone. Now, this antidiuretic hormone, what it does is retention of water. All right. So, retention of water is done by your antidiuretic hormone. Okay. Now, look here, guys. What exactly I'm trying to teach you people is that, now, vasopressin, normally what happens is that, so vasopressin analogs are there. Vasopressin analogs. Vasopressin analogs. What are these vasopressin analogs? These are some artificial chemicals which work similar to that of vasopressin. Now, when you look at a vasopressin analogs, my dear students, we have drugs such as desmopressin. Okay. Now, we have one more drug called as telepressin. What is that? Telepressin. Okay. There is one more drug called as lipressin. If you notice here, all of this vasopressin itself, okay, all the drugs will have some common name, pressin. What is that? Pressin. Exactly, vasopressin, what exactly it does? Some of the most important, retention of the water, and also causes vasoconstriction. So these are the important aspects of your, what is that? Of your vasopressin. Now, desmopressin, telepressin, lipressin. Now, where do we use them? Just imagine, I have a patient who is not having vasopressin. See, his body is not producing vasopressin. Now, what is my treatment? Give him artificial vasopressin. That's it. So, exactly what I'm going to use? Desmopressin, that is a vasopressin analog. It is used for diabetes insipidus. Which type? That is only called as central type of diabetes insipidus. What do I mean by central type of diabetes insipidus? See, it's very simple. ADH is produced from the central nervous system that will come and act on the kidney. If there is a pathology in the kidney, we call it as a nephrogenic diabetes insipidus. If there is a decrease of ADH production, we call it as a central diabetes insipidus, where there is a less amount of vasopressin, we are giving extra vasopressin, we are going to call it as a central diabetes insipidus. Okay. Now, for central diabetes insipidus, the drug used is a desmopressin. Okay. Now, apart from that, my dear students, there is one more MCQ oriented point. This is also a drug of choice for one disease, for something called as von Willebrand disease. Now, what is this von Willebrand disease? It is a disease in which what happens is that there is a reduction of the von Willebrand factor, okay, which is responsible for the stabilization of the factor number 8. But you people might be thinking, sir, what does it have to do with, what is that? Your clotting pathway. So, there is no direct mechanism, but it is said that it will increase the production of von Willebrand factor. He said that it will increase the production of von Willebrand factor. That is why we are going to use it. Now, telepressin and lipressin, widely, where do we use them? Widely, we use them in the treatment of esophageal 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 varices bleeding. What is this esophageal varices? Now listen to me very carefully. When a patient who is having a chronic liver disease induced by alcohol or any other things, if there is a chronic liver disease and a liver cirrhosis, what happens is that there is a dilation of the veins in the esophagus. Because of the dilation of the veins in the esophagus, those veins might rupture anytime. If there is a rupture of those veins, that person can end up into bleeding. During the resuscitation of the esophageal varices, we are going to use these drugs, telepressin and lipresin, but most importantly, desmopressin is used for what? Central diabetes insipidus. This is the most important points which you need to remember from the vasopressin analogs, which you should always remember. Okay, now once you know about this, my dear students, let's go to the next aspect. What is that? Oxytocin. Oxytocin. Now, what is this oxytocin story? Now, oxytocin story is very easy. Oxytocin story is very easy. What is that? Oxytocin, normally what is the function of oxytocin? The function of oxytocin, all of you very well know, it is responsible for uterine contraction. It is responsible for the uterine contraction. Okay, so if female is undergoing labor, during the labor uterus will undergo contraction with the help of a hormone called as oxytocin. Okay, now when you're talking about oxytocin, now oxytocin, whenever it is working, it is lead to uterine contraction. So where do we use it as a drug? Where do we use it as a drug? We use it as a drug in which type of condition? It is used in the condition called as atony of the uterus. What is that? Atony of the uterus. If uterus of the female is not contracting, to contract the uterus of the female, we are going to use it, and also used for augmentation of the labor. Augmentation of the labor, but not for the induction, but augmentation of the labor. So if you need to promote the labor activity better when it is already happening, then you can give oxytocin, but not for the induction, of the labor. The next important aspect here, write down, there is one important aspect you people will always need to remember, that is called as lactogenesis. And there is one more term called as lactokinesis. Now understand, during breastfeeding, mother has to feed the baby, so milk has to be secreted. For the synthesis of the milk, you are needing one hormone called as prolactin, my dear students. What is that? Prolactin, my dear students. And apart from that, lactokinesis means for the movement of the milk from the acinus into the nipple, means if milk has to come out from the breast, that movement of the milk will occur with the help of oxytocin. Again, this is a very important MCQ, which is lactokinetic agent, which is lactogenetic substance. Okay. Now, the next important aspect is that oxytocin. Can anybody tell me oxytocin? Is there any other biological role of oxytocin? So don't forget this. Oxytocin's biological role, that is the most important role, is what is that? That is hormone of love. Hormone of love. What is a hormone of love? That is your oxytocin. So this finishes your posterior pituitary. Important aspects. Okay. Now, my dear students, we have one more thing. See, oxytocin will act on the receptor and it works. But there is something called as oxytocin antagonist. And there is one more thing, that is your progesterone antagonist. So these two are very important, progesterone antagonist and oxytocin antagonist. Now, oxytocin antagonist, we have a drug, but it is not a drug of choice for anything. The name of the drug, remember, that is only called as atosiban. Atosiban is what? Oxytocin antagonist, but it is not a drug of choice for anything. Yes, we have that drug. Now, progesterone antagonist, don't get confused. That is your mifeproston. What is that? Mifeproston, which is used for the MTP, medical termination of the pregnancy. During MTP, we use this drug, mifeproston. Mifeproston, along with the combination of misoprostol, you'll study the dose administration from the gynecologist. Okay? Now, once we understood about this, let's go to the next hormone, that is your growth hormone. My dear students, growth hormone, you need to understand what is that. From the hypothalamus, there is somebody coming, that is only your growth hormone releasing hormone. Growth hormone releasing hormone that will go and stimulate your anterior pituitary. Now anterior pituitary will produce growth hormone. Now this growth hormone will stimulate what is that? Growth hormone receptors. Now this growth hormone receptor will produce something called as insulin like growth factor. So it produces insulin like growth factor. Now this will induce the growth in a human. Okay. So if your bones, etc., everything, if it has to grow, you require one hormone, that is your growth hormone, that acts by a what? That is acting by a insulin like growth factor 1. Okay. Now, what exactly happens is that there are two diseases. There is something called as acromegaly. Okay. Now, acromegaly is what? It is seen in the adult patients. Where there is an increase of the growth hormone. If there is an increase of the growth hormone, you will develop the symptoms such as the growth of what is that? Growth of the jaw, protrusion of the jaw. There is excessive cartilaginous growth. Now, my question, for me, I got this very interesting question. Okay, I was teaching growth hormone. I told my students excessive growth of the cartilages. Okay. One student from behind, he raises his hand, all of a sudden he'll ask, sir, penis does not have a bone. Okay. Now if there is more growth hormone, will it enlarge penis? And this is a serious MCQ also. If I ever ask you people, if more growth hormone, will it enlarge penis? Now, there is no enlargement of the penis because penis is made out of some tissue called as cavernosa and corporal tissue, which is more like a blood vessel, not a cartilage. So growth hormone increase does not enlarge the penis size. One myth busted for you people. Okay. Now what I can do? I can do the treatment of acromegaly. How can I treat the acromegaly? We are going to use something called as, we can use somatostatin. Now, this somatostatin is what? See, you have a somatostatin. You need to focus on the word here. Statin means which will stop the effect of the growth hormone, which is produced by the body itself and also artificially also manufactured. Got it? Now, there is somatostatin is there. Its analog is there. What is the name of the analog? Octreotide. Okay. Now, somatostatin analog, we have octreotide. Then we can use one more drug that is only called as, my dear students, pegvisomant. Okay. Pegvisomant is what? It is a growth hormone receptor antagonist. Again, this is one of the important MCQ, the mechanism of action of pegvisomant. But pegvisomant has one drawback. When you use a pegvisomant, it is like a drinking a peg. After a person drinks a peg, what will happen? Very good. After a person drinks a peg, what will happen? He will do all these things and he will develop what is that? He will not be able to see the things properly, like that only. So pegvisomant will cause, this is a technique to remember. Okay. So this is a technique to remember. Pegvisomant causes visual disturbances. Yesterday also I told you people, what is that? There is one drug which causes visual disturbance from the anti-epileptics, that is vigabatrin. What is that? Vigabatrin. That is a GABA transaminase inhibitors. Okay. Now, let's go to the next important aspect. So, if there is a acromegaly, we are going to treat this person. Okay. Now, let's go to the next aspect. You people might be asking me, sir, for gigantism patient, why can't we use it? For gigantism patient, we need to rule out the cause for this. Okay. Because most of the time it is due to craniopharyngiomas. So, we need to go for a surgical treatment also. That is the important aspect. Okay. Very good, Ashwan. That is vigabattin. Correct. Okay. Now, let's go to the next aspect. What is that, my dear? The next important aspect, somatostatin we understood, pegvisomant analogs we understood. Then the next important aspect, for example, patient is having a dwarfism. Patient is having a dwarfism. Means what? He is having a growth retardation. He is having a growth retardation or short growth. That time what we are going to use? We are going to use something called as GHRH, growth hormone releasing hormone analogs. So those analogs are somatropin. There is one more thing, that is somatorelin. Okay. So what is that? Somatropin and somatorelin. But I want you to remember at least this particular aspect, pegvisomant and octreotide. Octreotide is what? Somatostatin analog. Okay. If they ask you which somatostatin analog is used, then you are going to mark it as a octreotide. Here everybody? Now, I will give you people one task. What is the task? What is the difference between acromegaly and gigantism? Now, you people will tell me gigantism is seen in children, acromegaly is seen in adult. But why do we have to classify it differently? Is there any reason? Find it out. If not, I'll tell you at the end if somebody will remind me that. Okay. Now, we understood about the dwarfism. Now, once we understood about the dwarfism, now let's go to the next important aspect. What is that next important aspect? We are done with the important related to growth hormone. Once we understood about growth hormone, my dear students, let's learn about prolactin. Okay. Now, prolactin is what? Understand prolactin. Prolactin is regulated by one substance, that is only prolactin inhibiting hormone, that is your dopamine. Now, prolactin inhibiting hormone is dopamine. Now, this dopamine, if there is an increase of the dopamine activity, that will lead to decrease of the prolactin. So, why we should know? Because, my dear students, you need to understand different treatment. There are different strategies of the treatment. I'll tell you the different strategies of the treatment for any other gigantism and any other thing. That is not a treatment strategy, but the treatment strategy will vary upon the cause of it. Okay. If there is a tumor, yes, you are going to go for tumor. So that is not the reason, but there is one more thing. Okay. Now let's get to it. Now, dopamine will do what? Prolactin decrease. Okay. Now we have a conditions called as, what exactly happens if there is a increase of prolactin caused by diseases such as prolactinoma. So it is a tumor which produces the prolactin. If there is a prolactinoma, what will happen? There is an increase of prolactin. It will inhibit something called as HPO axis, hypothalamo pituitary ovarian axis in the female, and it will also inhibit hypothalamo pituitary testicular axis in the male. So both of the axes are inhibited, means female will not be able to ovulate, male will not be able to generate the testosterone. Now what will happen because of that? It will lead to infertility. Okay. Now understand one important aspect in gynecology also. You'll get to know any infertility, first thing you are going to rule out is prolactin or prolactin level. Okay. Now, what is the treatment for the prolactinoma? The treatment for the prolactinoma, what we can do? Dopamine agonist. If you stimulate the dopamine receptor, automatically there is a decrease of the prolactin level. Dopamine agonist drugs are your bromocriptine. We have drugs such as cabergoline. Okay. Now, among these two things, remember, cabergoline is the drug of choice because of its duration of action. It is a type of long acting. Okay. Okay, so you are telling about the growth hormone, right? So I'll clear that growth hormone thing. Very important aspect. What is that? The complete growth plate is fused in a adult. In the adult, there is no bone growth which can occur after the fusion of the growth plate. If there is a more growth hormone, it will lead to acromegaly. But in the children, growth plate is not fused, so bones will also grow. So the growth will be symmetrical. That is why we call it as a gigantism. Okay. That is the reason. Now, let's go to the next aspect. Bromocriptine is there, dopamine is there, dopamine agonist is there. Okay. Now, my dear students, I want you to understand one of the most interesting fact here is that there is a surgical treatment also for prolactinoma. The surgical treatment in the prolactinoma is your gamma knife and transphenyidal resection surgery also there. Okay. Now, the next important, if the pregnant female has any condition with hyperprolactinemia, any condition with increase of prolactin, you can use bromocriptine and cabergoline. For the tumor prolactinoma, cabergoline. For other condition, you can consider bromocriptine. Done? Sure. Let's continue. Now, the next important aspect, once you understood about the prolactin, let's go to the next important organ, that is your thyroid gland. Thyroid gland. My dear students, during the thyroid gland, you need to understand what is that. That is a very, very important step. What exactly is that important step? Listen to me very carefully. Now, we have some hormone from the hypothalamus called as thyroid releasing hormone. It will go and stimulate the pituitary. It will go and stimulate the pituitary. Pituitary will produce your thyroid stimulating hormone. Now, this thyroid stimulating hormone will act upon the thyroid gland. Will act upon what? Thyroid gland. Thyroid gland. Now, this thyroid gland will produce T3 and T4. Will produce T3 and T4. So, this is how it is working. Okay. For this T3 and T4 production, you require a process called as organification of iodine. Organification of iodine. Organification of iodine. So, this organification of iodine is done with the help of an enzyme. Done with the help of an enzyme called as thyroid peroxidase. Thyroid peroxidase. Okay, so simple as that. For the production of T3, T4, you require one hormone. What is that, sir? That is your thyroid peroxidase. Okay, why am I teaching you people this? Okay, so any patient who is having a thyroid related disorder, he will have two of these possibilities. One of them is hyperthyroidism. Hyperthyroidism. Okay, then there is a possibility that hypothyroidism. For the patient who is having a hyperthyroidism, the causes for hyperthyroidism, I'll tell you the most common cause you need to remember, that is a Graves' disease. It is a type of autoimmune disease. It's a type of autoimmune disease. In this autoimmune disease, what happens is that there is a long-acting stimulatory antibodies to the TSH receptor. If you want to write down, there is a long-acting TSH and there is a long-acting antibody to the TSH receptor which will stimulate the TSH receptor in the Graves' disease. So during this condition, what we are going to do? We are going to inhibit TPO. Thyroid peroxidase inhibitor. Now, what and all you need to know from pharmacology side. Now, I'll tell you people the first and most important thing. This propyl thiouracil is a very, very important one. What is that? Because it will cause some side effects. It will cause some side effects. What are those side effects? Can anybody tell me? So, all of you might be knowing that is agranulocytosis. Agranulocytosis. Yesterday I told you people one more drug will cause agranulocytosis. That is your clozapine. Apart from that, it is causing one side effect, that is black box effect. We call it as black box effect. This is the most dangerous side effect, that is your hepatitis. These are the two side effects which can be produced as a result of your propyl thiouracil. But the most important aspect is that if a pregnant female comes to you, definitely MCQ will come. So let's see, if a pregnant female with a hyperthyroidism, Pregnant female with a hyperthyroidism. Now, the pregnant female with a hyperthyroidism, what exactly we are going to do? Now, listen to me very carefully. Pregnant female who is having a hyperthyroidism, what we need to do is very, very easy to understand. So, understand if there is a first trimester, okay, if she is a first trimester pregnant female, then the drug of choice is your PTU, my dear students, that is propyl thiouracil, because of one thing, it is not having major effects on the fetus. That is why we are using it in the first trimester. What is that? Drug of choice is propyl thiouracil. After first trimester, then you can use carbimazole. You can use carbimazole, or you can use methimazole, methimazole. So these are the two important aspects I want you people to remember. What is that? Carbimazole and methimazole. These are the two side effect, two drugs which are very important for you people to understand. Why they are important to understand? Because these are the drugs which can be asked as a MCQ. The first trimester drug of choice is propyl thiouracil. This question has been asked again and again. So please be ready with it. Okay. Now, so all of you know about this. Then let's go to the next aspect. What is that, my dear students? If there is a hypothyroidism, if there is a hypothyroidism, what we are going to do? If there is a hypothyroidism, then we are going to do is very simple. What exactly is that for the hypothyroidism treatment? The treatment is very simple, guys. What exactly is that? The treatment is your levothyroxine, that is L-thyroxine. What is that? L-thyroxine. Now, L-thyroxine is a type of analog of T4. It is the analog of T4. Very good. L-thyroxine. Apart from L-thyroxine, nowadays we have one more drug that is only called as thyronin. It is a T3 analog. T3 analog. Now, this thyronin is a T3 analog which is used for emergency situation, which is used for the emergencies. Okay, it is not used for long-term management, but thyronin is used for what is that? That is for the T3 analog, which is used for the emergencies. Okay, so this can be asked as a MCQ. That is little bit latest into the syllabus. Okay, now let's go to the next aspect. What is that? We understood about the thyroid gland. Once you understood about the thyroid gland, let's go to the next important aspect. What is that next important aspect, my dear students? That next important aspect which you need to learn, must and should, is your which gland? Adrenal gland. What is that? Adrenal gland. We are going to learn about corticosteroids. What is that? Corticosteroids. So corticosteroids is a major and massive topic which will come in many places, but I will give you all the important points which will cover everything needed to know. But I want you people to pay very much attention when I'm telling you people, learn this point, learn that point. When I tell this, you need to be very, very attentive. Okay. Now, what exactly is that? Corticosteroids. Understand, you have your adrenal gland. You have your adrenal gland. In the adrenal gland, you have two regions. This is your adrenal medulla. You have adrenal cortex. Okay. Now, this adrenal cortex is responsible for the production of corticosteroids. This adrenal medulla is responsible for the production of mineralocorticoids. And also it is responsible for the production of testosterone. Now listen to me very carefully. We have some important aspect. What is that? That is three layers: zona glomerulosa, zona fasciculata, zona reticularis. These are the three layers of the adrenal cortex. So zona glomerulosa. Okay, zona glomerulosa will produce your mineralocorticoids, my dear students. What it will produce? It will produce your zona glomerulosa will produce your mineralocorticoids. Okay, glucocorticoids are produced by zona fasciculata, and zona reticularis will produce this testosterone. Okay, now understand, this particular gland is controlled by your one thing. What is that? In the hypothalamus, hypothalamus. It will produce something called as corticotropin releasing hormone that will go and stimulate your anterior pituitary. Your anterior pituitary is going to produce what? Your anterior pituitary is going to produce your ACTH. Now this ACTH, my dear students, will stimulate which layer? The layer is, it will stimulate the fasciculata layer. If it's stimulating the fasciculata layer, it will produce your glucocorticoids or corticosteroids. This is how your body is working in the process of making of corticosteroids. But the thing here you need to understand, we have something called as, from outside we have steroids. We call it as a exogenous corticosteroids. So basically exogenous glucocorticoids. Now when you look at exogenous glucocorticoids, my dear students, please understand some important aspect. What exactly is this important aspect? See, exogenous glucocorticoids, they are given from the outside of the body. So what are the mechanism of actions of these steroids? So this works similar to that of steroids in the body. So mechanism of action, the first and most important, they are anti-inflammatory. If they are anti-inflammatory, how exactly they will anti-inflammatory? Because they will inhibit one enzyme, that is only your phospholipase. There is one enzyme called as phospholipase. It will inhibit an enzyme called as phospholipase. Because of that, they will produce anti-inflammatory effect, and because of the same reason, they are also anti-allergic drugs. Okay, so why? Because they inhibit the phospholipase. So what is the role of this phospholipase? You can understand there is something called as phospholipids. Now these phospholipids will break down into arachidonic acid. Now this arachidonic acid will produce prostaglandins and leukotrienes Okay, now prostaglandins are responsible for the inflammation, and your leukotriene are responsible for the allergy. Okay, now where does our phospholipase come? Here, phospholipase. Now, if I inhibit this phospholipase, phospholipid will not get converted into arachidonic acid. So, no inflammation, no allergy. Clear, everybody? This is how you need to remember. Now, apart from that, guys, what and all it will do? Other things. Other things are, it is immunosuppressive in nature. Why? Because they will increase leukocyte, means WBC, leukocyte apoptosis. Since they are causing the leukocyte apoptosis, means if leukocytes die much quickly and faster, automatically what is going to happen? Leukocytes are dying. If leukocytes are dying, immune system will go down. If it is immunosuppressive in nature, because of which there is one side effect. If your immune system become weak, you will get opportunistic infections. Okay, then one more use is there, because you can suppress the immune system. They can be used during the organ transplant. Got the logic? Here, everybody? Okay. Now, the next important aspect, what is that? The next important aspect of this drug, these drugs, my dear students, they will cause, what is that? They will cause increase of the blood glucose. By what? By gluconeogenesis. By gluconeogenesis. What is gluconeogenesis? Synthesis of glucose from a non-carbohydrate source. We call it as a gluconeogenesis. They will increase the gluconeogenesis in the liver, leading to elevated blood glucose. So automatically they are contraindicated in diabetes mellitus. Even if used, maintain the sugar level. maintain the sugar level. So that is what during the COVID time there was a lot and lots of steroids used. So all the time steroids used, we need to advise our patients, or even we need to advise our young doctors to do what, to make sure that patient, if he's a diabetic, make sure to maintain his blood glucose level, make sure to maintain his blood glucose level. That was the reason, because gluconeogenesis. And my dear students, they will also increase the blood pressure by what? By sodium and water retention. Now if you people think about this, you people might understand, sir, yesterday you told us something, aldosterone also does the same thing, right? Yes, sir. Like aldosterone is what? Mineralocorticoid. Glucocorticoids can work like a mineralocorticoids. This is also important point to be remembered. This is also a very important point to be remembered for you people. Okay, now, the next important, so you understood about sodium water retention. Okay. Now, let's go to the next aspect. Guys, these steroids, for example, whenever you look at a steroids, they will cause increased activity of osteoclast. If they increase the activity of osteoclast, automatically they will lead to what? They will lead to one problem called as osteoporosis. So if you use these drugs for a longer period of time, osteoporosis can occur. Okay. Now, they will also cause, my dear students, fat redistribution. So if they are causing a fat redistribution, means they will accumulate the fat in one area from another area, leading to what is that? That is your central obesity. Even we can use a specific androgenic obesity or android obesity. We can call it as a android obesity. Now, apart from that, basically all the fat will accumulate where exactly? In the upper parts of the body, especially in the trunk and the face and the neck. So because of that, the face of the person, if you use this drug for a longer period of time, it will become, all the fat accumulated will become round. So we call it as a moon face. My dear students. And exactly, fat can also accumulate in the back of the neck, leading to something called as buffalo hump. Now, if you look here, what is that I'm trying to tell you people? Because of the fat redistribution. So, if there is a more of glucocorticoids from the body itself, are endogenous glucocorticoids more? Same effect. Exogenous glucocorticoids are more? Same effect. Okay. So, it is only called as Cushingoid behavior. Let's go to the next aspect. So let's understand some uses of the glucocorticoids. They are anti-inflammatory. Means they are used in the inflammatory diseases. Such as osteoarthritis, rheumatoid arthritis. For example, if a patient is not having an adrenal gland, see, surgically I removed both the adrenal glands. In that patient, I need to give what? Steroids. So basically, what is that? Replacement therapy. Okay. Apart from replacement therapy, for example, if adrenal gland is not working, we call it as a Cushing syndrome or Addison's disease. It is called as Addison's disease. They are used in the Addison's disease. Okay. Apart from Addison's disease, they're used in many other conditions. Agree with you people. So based on the requirement. Okay. For example, we use them for the treatment of keloids. Okay, we use them for the treatment of allergy. So the uses of the steroids become a wide range. The side effects of the steroid is very important. What is that? My dear students, side effect of the steroids, already you know, osteoporosis. Then there is a infections, that is opportunistic infections. Okay. Apart from opportunistic infections, then there can be peptic ulcer disease. Peptic ulcer disease, because there is no protection to the stomach, because there is no arachidonic acid synthesis. Now, apart from that, steroids can also lead to one of the most important and interesting aspect. What exactly is that? That is your fat redistribution. Fat redistribution. So I told you what happens in the fat redistribution. What happens here? That is android obesity, moon-like shape, moon-like face, and a buffalo hump. Okay. Now, apart from that, steroids, my dear students, these steroids are very interesting drugs in the eye. In the eye, they will cause two side effects. What are the two side effects? What are the two side effects? One of them is glaucoma. Glaucoma. Another one is cataract. Cataract. But the problem here is that they will ask you when cataract will come, when glaucoma will come. Then what will you say? So glaucoma will come, my dear students, if the drugs are applied directly in the eye. If there is a topical usage, if there is a topical use, then we are going to get glaucoma. Topical use, then we are going to get what? Glaucoma. If there is a systemic use, for a longer period of time, they can lead to your, what is that? That is your cataract. Okay. Other uses, such as you can use them in ulcerative colitis, Crohn's disease, though other drugs are there, along with them we can combine them. These drugs are used as a chemotherapeutic agents also. Okay. Now, let's continue to the next aspect. What is that next aspect? Guys, the next important aspect about the steroids, guys, steroids, when you are using them, so you need to do something, what is called as dose tapering. From pharmacology side, it is very important. Dose tapering must be done. Dose tapering must be done. What do I mean by dose tapering must be done? Now, listen to me very carefully. You give a steroid to a patient for 10 days. For how many days? 10 days. So 10 days he took the steroids. If he's taking the 10 days of steroid, now what happens? Let's go back and see what happens here is that. So, if you remember, if he's taking the steroids for 10 days, basically you are giving the corticosteroids from outside. Now, the steroids will go and give negative feedback to ACTH. Negative feedback to anterior pituitary means there is a decrease of ACTH production. Now, listen to me very carefully. If you use it for 10 days and stop them suddenly, if they're suddenly stopped, if suddenly stopped due to this negative feedback, continuously your steroids are telling not to produce, what is that? Not to produce the cortisol. If there is no cortisol, suddenly if you stop, do you have ACTH? No ACTH. Suddenly patient will develop acute adrenal insufficiency. So when the person develops acute adrenal insufficiency, treatment will be what? Again, you're going to give IV steroids. So to avoid this acute adrenal insufficiency, rather than stopping the drug all of a sudden, dropping the drug all of a sudden, we will drop it slowly. Means we will reduce the dose day by day, so that your body has time for the adaptation. So that is why dose tapering must be done. Clear? Anywhere if you hear a term tapering means what? To decrease the dose slowly. Okay. Now, yes, you are right. Intraocular pressure increases. That means it is causing glaucoma. Glaucoma is nothing but elevated intraocular pressure. Very good. Let's go to the next aspect. What is that next aspect? The drugs, steroid drugs we have. So what are the drugs we have? All the steroid drugs are divided into three groups. They're called as short-acting drugs. They're called as intermediate acting drugs. Then there is something called as long-acting drugs. What are the three groups? Short-acting, intermediate-acting, and a long-acting drug. Now, among these things, short-acting drug, we have something called as cortisone. We have one more drug, hydrocortisone. What is that? Hydrocortisone. So, short-acting drugs are used for what? Emergency. Okay. Then, we have intermediate. Intermediate drugs, we have a drug called as prednisone. We have one more drug called as prednisolone. Okay. We have one more drug. What is that? Methylprednisolone. Methylprednisolone. Okay, apart from methylprednisolone, see, prednisolone and methylprednisolone, they both are available in the form of a tablet. If you can't remember, it's not so much to be worried. Okay, now prednisolone, methylprednisolone. Apart from that, budenoside. Budenoside. Budenoside is available in the form of inhalation. For the treatment of asthma, for the treatment of bronchial asthma. It is available in the form of a inhalating agent. Okay. Now long-acting drugs. We have a drug called as dexamethasone. Now, apart from that, we have one more drug called as betamethasone. Okay, betamethasone and dexamethasone. We have one more drug called as paramethasone. But I want you to understand what is this dexamethasone. Dexamethasone is used for what? It is used for the preterm labor. During the preterm labor, we use this dexamethasone to cause the fetal lung maturation. Okay, usually the preferred drug is dexamethasone, but sometimes we can also go for betamethasone, nothing to worry. Okay, this is a story of your what is that? Steroids, my dear. What is that? Steroids. Understood? Okay, once you understood about the steroids, let's go to the next important aspect. What is that next important aspect? That next important aspect is what is that? That is the most important topic, that is diabetes. Which diabetes? Diabetes mellitus. So when you're talking about diabetes mellitus, guys, understand the diabetes mellitus topic. It is very easy for you people, but you need to learn a lot of information here, and I'll teach you all the important aspects which are required for your exam. Okay. Now, when we are learning about diabetes mellitus, so we have type 1, diabetes, we have type 2 diabetes. So type 1 diabetes and type 2 diabetes mellitus. Here, what happens in type 1 diabetes mellitus? What is that? Insulin dependent. Means what is that? There is a decreased insulin. But in type 2 diabetes mellitus, there is sufficient amount of insulin. But the problem is that insulin resistant. Okay. Now insulin resistance is there. Along with that, sufficient amount is there for what? Basal level of insulin is there, but postprandial is totally different. Postprandial insulin will be affected. Apart from the postprandial insulin, there is one more problem here, that is relative hypoinsulinemia. Okay. Now, in both of these conditions, there is an increase of blood glucose. Our treatment is what is that? Treatment is your what is that? That is your to decrease the blood glucose. So the first group of olden group of drugs, they are your biguanides. What is that? Biguanides. In the biguanides, we have drug called as metformin. Along with metformin, we have one more drug called as fenformin. Very good, Yashwant, you're right. Okay. Now, we have a drug called as metformin and fenformin. But metformin is a widely used drug, and there is a lot of important MCQs related to biguanide metformin. So, the first important, how does this drug work? Mechanism of action. The mechanism of action, it will inhibit hepatic glucose synthesis. So it will stop the synthesis of the glucose from where? From the liver. So once glucose from the liver production is reduced, automatically blood glucose level will be reduced. That is the point you need to understand. So what happens here? There is a decreased level of blood glucose as a result of what? Inhibition of very important hepatic glucose production. Means this drug will go and tell the liver, hey liver, you don't stop, you don't produce more glucose. Like that only it is working. But the problem here is that there are some side effects. What are the side effects caused by metformin? Metformin will lead to something called as megaloblastic anemia. It will lead to a problem, megaloblastic anemia. Megaloblastic anemia. Okay. Apart from the megaloblastic anemia, is there anything else? Yes. If used in a patient, if used in a patient with what is that? Renal failure. If used in a patient with a renal failure, then automatically, my dear students, it will lead to something called as lactic acidosis. So these are the few important points you need to remember from the side of metformin. Okay. Now apart from that, it will affect the weight. Agree with you. But the most important ones which you need to know is megaloblastic anemia and lactic acidosis. Okay. Now once you understood about this, let's go to the next important drug. What are those drugs? They're called as sulfonyl ureases. Now this sulfonyl ureases, we have many drugs, my dear students, but what exactly they are going to do? These drugs will increase the insulin production. Okay. Now if they're increasing the insulin production, now you might be thinking, sir, they're more used in which condition? Diabetes mellitus type 1 or type 2? They're used for type 2, but still they are increasing the insulin production and also improve the resistance by increasing the sensitivity. They also slightly increase the sensitivity to insulin. They will increase the sensitivity to insulin as well as your, what is that? They will increase your insulin production. There are drugs such as tolbutamide. We have such as glicazide. We have drugs such as glimepiride. So remember, glimepiride, very commonly used drug, glimepiride, along with metformin. Okay. Then apart from glimepiride, we have one more drug. What is that? Gibanclamide. Actually, if you are speaking, if at all we were learning, like, full syllabus, there are 2 generations we could have gone into that one. Okay. But you need to remember at least these ones. Okay. Tolbutamide is one drug which undergoes zero order kinetics. But only substance which undergoes truly zero order kinetics is followed by only one drug. What is that? One substance in the body. Tell me. Truly zero order kinetics is followed by only one substance in the human body. Which is that substance? I taught you people already. That substance is your alcohol, my dear students. What is that? Alcohol. Okay. Now, let's go to the next important aspect. What exactly is that? Guys, we eat food, right? Food consists of starch, basically. Now, this starch, my dear students, under the effect of an enzyme called as alpha glucosidase, under the influence of an enzyme called as alpha, that is alcohol. The answer is alcohol. Very good. Ethanol. Very good. Okay. Now, listen to me very carefully. Starch under the effect of alpha glucosidase, what will happen is that it will, my dear students, what will happen? It will convert into glucose and it will get absorbed. Now exactly what we are going to do, we are going to inhibit the alpha glucosidase. The alpha glucosidase inhibitor drugs such as acarbose, maglitol, and we have one more drug called as oglibose. Okay, so these 3 drugs will inhibit the alpha glucosidase. Now, because of this drug, listen to me very carefully. Alpha glucosidase is inhibited. Now, glucose is not formed. Glucose is not absorbed. If glucose is not absorbed, automatically blood glucose levels are less. But the issue here is that if you notice, all this starch, whatever is there, now this starch will enter into the feces, leading to flatulence, excessive flatulence. Okay. Now, the question is that when do we take this drug? When to take this drug? Okay. Options I'll give you. Option A, before meal. Option B, after meal. Option C. Between food. Option D. None of the above. Okay, so when you look at this, yes, gas, that is only flatulence will be the side effect. So when do we take this drug? Understand, between the food. Between the food means what? Means whenever person is eating the food. So if you tell this patient what you need to do, you ask the patient to take this tablet. How exactly? You'll ask him, okay, while eating the breakfast, eat half of your breakfast, take the tablet, then finish the breakfast. Not postprandial, not before meal, nothing. With the food, between the food, like, if he's having 2 idlis, we will ask him after eating 1 idli, take the tablet, then you do what? Then you complete the second idli. Like that only we need to advise the patient. Okay. So please don't get confused. Clear, doctors? Very good. The next important, this is the MCQ what you can get from this particular group of drugs. Most likely if you get also. Okay, then let's go to the next group of drugs. What is the next group of drugs? There is one more drug called as amylin analog. What is that? Amylin analog. Okay, now when you're talking about amylin analog, my dear students, it will decrease amylin. Normally it will decrease the blood glucose. It will decrease the blood glucose. Okay, it will decrease the blood glucose. The drug what we have is called as pramlintide. Okay, so this pramlintide is what? Listen to me very carefully. This pramlintide is a amylin analog. If you notice here, the drug itself will contain amylin in its name. Okay, pramlintide. Okay, now pramlintide is a amylin analog. It is used for which condition? Used for both of the diabetes, both type 1 and type 2 diabetes mellitus. Both type 1 and type 2 diabetes mellitus, it can be used. Clear? So this is your amylin analog. Okay, now there is one more drug, sir. What is that? My dear students, we have something called as incretin mimetics. Okay, now if you need to understand incretin mimetics, you need to understand incretin. So what exactly incretin does? Incretin, my dear students, it will increase the insulin production. It will increase the insulin production and decrease the blood glucose. This is a function of your incretin. Now if you use incretin analog, what is that? Incretin analog, then what will happen? Let's see. Okay, now incretin is there. Incretin is also known as GLP, glucagon like peptide 1. GLP-1. Okay, now listen to me. We have incretin. Now this incretin is metabolized into its products. By one enzyme called as dipeptidase. Dipeptidase 4. DDP4. We can also call it as a DDP4, my dear students. So now listen to me very carefully. Normally body will produce incretin. Incretin is produced from which cells? From physiology you should answer this, from the L cells. Incretin is produced from the L cell. Now incretin will increase the insulin production and decrease the blood glucose. But in the body, incretin is metabolized by an enzyme DDP4. Now you can do few things. What is that? You can do one thing. What is that? Incretin mimetics. Incretins analogs. So if you are using incretin analogs, can anybody tell me incretin analogs? So we have a drug called as exenatide. What is that? Exenatide. And we have one more drug called as liraglutide. So these two drugs, exenatide and liraglutide, these are the incretin analogs. We can do one more thing. What is that? DDP4 inhibitors. These DDP4 inhibitors are your gliptins, my dear students. What are those? Gliptins. Okay, now if you want to understand if you want to understand. Now, please understand. So, we have exenatide, okay, we have liraglutide, okay. Now, listen to me, DDP4 inhibitor, gliptins. The drugs are vildagliptin, okay. Then we have drugs such as sitagliptin. Okay. Then apart from sitagliptin, then vildagliptin, we have one more drug, that is saxagliptin. That is your saxagliptin. Okay. All of these gliptins, they can ask you directly mechanism. Okay. Now both of these drugs can lead to one side effect. What is that side effect? Can anybody tell me? Can cause pancreatitis. Okay, so both of these drugs, gliptins, okay, ritagliptin, yeah, all the gliptins, okay, sita, rita, okay. Now, listen to me very carefully. The both drugs can cause pancreatitis, my dear students, okay. Both of these drugs can cause pancreatitis, okay. Now, once you understood about this, let's go to the next important group of drugs. There can be a very important MCQ. What is that? My dear students, we have SGLT2 inhibitors. Now, SGLT2 inhibitors, how do they work? I'll tell you people, listen to me. If you consider this is your nephron, right? In the nephron, what happens is that whatever glucose which get filtered into the nephron, it used to get reabsorbed with the help of SGLT2 in the kidney. Now, if I block this SGLT2, automatically glucose will go into urine. Which will lead to decrease of blood glucose. Okay. At the same time, more glucose in the urine. This is the story you need to remember. Okay, so basically we are stopping the reabsorption of glucose. They will do what? Inhibit glucose reabsorption. From where? Reabsorption from can anybody tell me? From the proximal convoluted tubule of the nephron. Okay. Now, these SGLT2 inhibitors, the drugs we have are your one of the most important aspect. What is that? They are your dapagliflozin. Okay, dapagliflozin. Okay, so we have one more drug, that is canagliflozin. Okay, now all the gliflozins, dapagliflozin, canagliflozin, all these drugs will cause SGLT2 blockade. Yes, present only in the kidneys, but SGLT1 is located present only in the intestine. Okay. Now, once you understood about this, my dear students, please understand the next aspect. What is that next aspect? The side effects of this drug. What is that? Side effect of this drug. What is that side effect? Increase of the glucose in the urine. Okay, if there is an increase of the glucose in the urine, that will lead to more glucose in the urine, means more bacteria can get accumulated in the urinary tract, or more bacteria can grow in the urinary tract, leading to urinary tract infections, and genital infection is a very common side effect caused by SGLT2 inhibitors. This is a very, very important aspect. Very good. Understood everybody so far whatever I told you people? Understood? So the last and most important drugs which I want to teach you people, glitazones. Okay. Now glitazones belong to a group called as thiazolidinediones. Belong to a group called as thiazolidinediones. Even if you can't recall the name, I want you to remember this much. What is that? Glitazones. Okay, so what is this glitazones? The classic example, we have a drug called as pioglitazone. Pioglitazone. The mechanism of action is what? They are insulin sensitizers. What do I mean by insulin sensitizer? How do they act? I will teach you people how do they act very easily. Listen to me very carefully. If you take a cell, inside the cell there is a nucleus. Inside the cell there is a nucleus. On the nucleus we have some receptor called as PPAR receptors. PPAR receptor. Now PPAR receptor, I told you, paroxysmal proliferative activator receptor. Paroxysmal proliferative activator receptor. Now these PPAR receptors are divided into two types. PPAR alpha, PPAR gamma. Now these PPAR alpha receptors, which drugs exactly act? They are fibrates. The drugs which act on the PPAR alpha receptors are fibrates, which decrease the fat or cholesterol level in the body. Now, these glitazones, if PPAR gamma is stimulated by which drugs? Glitazones. Now, this PPAR gamma stimulation will lead to what? PPAR gamma stimulation will lead to insulin sensitivity. So this is the story of your anti-diabetic agents, all the important MCQs related to it. Clear everybody? So this is a quick review of your endocrine system. So let's take a small break of 5 to 6 minutes, about 5 to 6 minutes. Then we will come back and continue with our chemotherapy and antibiotics. All right, guys, welcome back. So we discussed about what is that? Diabetes mellitus. Okay, apart from diabetes mellitus, we discussed about steroids, thyroidism. Okay, then apart from that, we discussed about other drugs as well. Now, once we're done with that, let's get into one of the most interesting and important aspects. So everyone back? Okay, so let's get into the topic. The name of the topic which we are going to discuss is your antibiotics. My dear students, antibiotics is a very important, and understand antibiotics for clinical practice will become very important for you people. Why? Because clinically speaking, there are so many antibiotics which you might require for the usage, which have there is a very objective things which happens with the antibiotic also. See, there's a rational treatment. Along with the rational treatment, there are some objective things, because there is something called as concept of P drug. So because of this concept of P drug, there are some cases which some drugs might vary. Okay, but you need to understand the antibiotics. Now when we need to understand the antibiotics, so please understand first what happened. I had a fungus with me. Listen to this story. I had a fungus. Okay. This fungus was sitting quietly here like this. Fungus was sitting quietly here. Now what happened is that to this fungus, whatever sitting quietly, some bacteria came and infected the fungus. Look at this. Bacteria came and infected the fungus. Now fungus got very irritated. How can you infect me? Fungus will produce some chemical. Now this chemical will go and kill the bacteria. Look at this. Fungus will go and kill the bacteria. So the chemical, whatever it came out from here, this was an antibiotic. So that is how the antibiotic discovery started. So the first antibiotic penicillin was from the fungus itself. So there are some antibiotics which are naturally produced usually from fungus. Now I'm trying to tell you people is that antibiotics are the chemicals which might try to kill the bacteria, Now when we need to understand the bacteria, killing agents, these are your antibiotics. So please guys, see, it's very easy to understand. There are types of antibiotics. What are those? There are antibiotics. They're called as cell wall synthesis inhibitor. So, cell wall synthesis inhibitor. Now, cell wall synthesis inhibitors. What are these cell wall synthesis inhibitor? So, cell wall synthesis inhibitor are any such antibiotics which will stop the bacterial cell wall growth. Bacterial cell wall growth. If bacterial cell wall growth is being stopped, okay, now that is going to automatically kill the bacteria, leading to a effect called as a bactericidal effect. Bactericidal effect. What is that? Bactericidal effect. So bactericidal effect can be achieved from your, which is that, cell wall synthesis inhibitors, right? When we need to understand the cell wall synthesis inhibitor, in the cell wall synthesis inhibitor, the first group of antibiotics we have are penicillins. What is that? Penicillins. So penicillins, my dear students, we have some penicillins which are naturally derived penicillins called as natural penicillins. Natural penicillins. Natural penicillins, we have drugs such as penicillin G, okay, penicillin G. Now this penicillin G and also some penicillin V, these both are considered to be, what is that, natural penicillins, okay. Now apart from that, we have some penicillins which are orally used. Those orally used penicillins, classically the orally used penicillins are your aminopenicillins. These aminopenicillins, the drugs are amoxicillin. Then we have one more way called as ampicillin. Okay. So these antibiotics, what are these? These penicillins orally used are aminopenicillin, and aminopenicillins have amoxicillin and ampicillin. So there are other types of penicillin, but majorly I'm focusing on which are majorly widely used in our clinical practice and exam, since it is a review point of view we are going on here. Okay. Now, apart from that, see, penicillin, whenever you learn about antibiotics, you have to know about something called a spectrum. Spectrum means to what range of bacteria this antibiotic can kill. So the antibiotics can kill all the microorganisms in the existence. Possibility number one, the bacteria can kill only gram-positive bacteria. The bacteria can kill only gram-positive and gram-negative bacteria. So based on its effect on different microorganisms, we divide the spectrum. The spectrum of these antibiotics we have, they usually kill the gram-positive, okay. So gram-positive bacteria, we have, what is that, gram-positive bacteria can be killed. And most importantly cocci can also be killed. So cocci such as for example meningococci, such as for example meningococci. Apart from meningococci, we have one more thing, that is gonococci. Okay. Now, when you understand about the penicillins, so you need to focus on some of the basic important aspects. What are those basic important aspects? My dear students, this penicillin's mechanism of action is very easy to understand. They inhibit, first most important thing, the cross-linking in the cell wall. Basically, if the cell wall of the bacteria has to be produced, there should be a proper cross-linking of the substances in the cell wall. If there is no cross-linking, there is no formation of the cell wall. If there is no formation of the cell wall, so that will be what? Yes, it will be posterior. Okay. So then what will happen? Bacteria will not be growing, whether it will die, rather it will die. Now, cross-linking of the cell wall will be inhibited. The second aspect is that something called as a penicillin binding proteins. Now this penicillin binding proteins is what? In the every bacteria, there are some aspects of the bacteria itself where penicillin will go and sit, and it will stop the growth of the cell wall. See, penicillin will go and bind to a place called as penicillin binding protein which is present in the bacteria and stop the cell wall synthesis. This is also one more mechanism. This is also what? One more mechanism of the penicillins. These are the two important mechanisms. Okay. Now, next important aspect, guys. The next important aspect, the uses of the penicillins. I am going to tell you few uses, and apart from that, as you study specific infection, the antibiotics will be added according to that also. Okay. Now, we are going to learn about the uses. They are used for meningococcal infection, meningococcal infection, meningococcal infection. Then they are used for gonococcal infection, gonococcal infection. They're used for one more aspect. What is that? That most important aspect, my dear students, in the treatment of syphilis, in the treatment of syphilis. Okay. Now, in the treatment of syphilis, after penicillin usage, after penicillin usage, there will be what? There will be, can anybody tell me? There will be something called as Herxheimer phenomena. Herxheimer phenomena. Basically, what is this? This phenomenon is a simple thing. This is a type of immunological response to the penicillins during the treatment of syphilis. We call it as a Jarisch-Herxheimer phenomena. Actually pronounced as a Harish-Herxheimer phenomena. Okay. Now, apart from syphilis, they are also used in the patient with rheumatic fever, my dear students. Rheumatic fever. So rheumatic fever is usually a pediatric condition, but to prevent, what is that? To prevent the, what is that? That is your autoimmune diseases in the further, and other destruction, we are going to apply this antibiotic as well. We are going to apply, especially in the rheumatic fever, we use a penicillin called as benzathine penicillin. Benzathine penicillin. This benzathine penicillin is used intramuscularly. Okay. Now these are few uses about penicillins. Okay. Now there are some facts also you need to remember. Penicillins usually parenteral route of administration. Most of the penicillins should be used parenterally except for few orally used penicillins. Okay. Now, usually parenteral. The next important aspect, they have wide therapeutic index. Wide therapeutic index. Okay, so this is some interesting things to be known. Okay, so once you understood about the penicillin, then there is one more penicillin, that is your methicillin. There is a penicillin called as methicillin. What is that? Methicillin. Now this methicillin fellow, what he's going to do? Now what he's going to do is that this methicillin is not used clinically. Clinically we are not going to use it, but rather used in the laboratory. For what? Laboratory to determine, to find out something called as what is that? Resistance of what is that? Of the Staphylococcus aureus to methicillin. If the bacteria that is Staphylococcus aureus, if it is resistant to methicillin or not resistant to methicillin, to find out that we are going to use methicillin. Now what is the use? Now understand, if the Staphylococcus aureus, whatever we checked, if it is sensitive to what? Methicillin. If it is sensitive to methicillin, means if it is getting killed by the methicillin, then we are going to treat the patient with penicillins. Okay. Now, for example, you find resistance. Then, my dear students, we call it as a MRSA, methicillin resistant Staphylococcus aureus. In that condition, drug of choice will be your vancomycin. Now, this vancomycin again is a type of cell wall synthesis inhibitor. Now, this vancomycin is a drug of choice for MRSA. Now, vancomycin also used for one more condition, for something called as pseudomembranous enterocolitis, pseudomembranous enterocolitis. So for the pseudomembranous enterocolitis also the drug is your again vancomycin. Is your vancomycin. Everybody clear so far? So here we discussed about few antibiotics. What are those? That is your vancomycin done, penicillins are done. Let's go to the next aspect. My dear students, next aspect, there is something called as cephalosporins. Cephalosporins. Now, cephalosporins, I'm not going to waste much time. Cephalosporins, I will tell you all the facts which you need to know. Now, listen to me. Cephalosporins are 5 generations. 5 generations. Okay. Now, in that most commonly used are your third gen cephalosporins. Third generation cephalosporins such as cefixime, okay, ceftriaxone. Now, when I'm trying to tell you people cefixime and ceftriaxone, understand ceftriaxone is the drug of choice. This is a very controversial question. Drug of choice for what is that? Empirical treatment. What is that? Empirical treatment of meningitis. Empirical treatment of meningitis. For the empirical treatment of meningitis, what is the drug? That is your ceftriaxone. Remember this particular. Empirical treatment means what? You might be having, sir, what is empirical treatment? Now, you get a patient who is having what is that? Meningitis, right? Now, meningitis, you can have a clinical diagnosis, but before finding the cause, there are 2 aspects. Before finding the cause, after finding the cause. After knowing the cause, specific treatment will be given. But before finding the cause, what is the treatment you are going to give? Ceftriaxone. Very good. Very good. Now, cephalosporins, I agree. Cephalosporins and penicillins, both of them will have some common point. Have something called as beta-lactam ring. So, this both antibiotics works with the help of a ring called as beta-lactam ring. Without this beta-lactam ring, these drugs cannot work. So, cephalosporins and your what is that? That is your penicillins. Now, if you look here, cephalosporin and penicillin, they will also show one more thing called as cross allergy, my dear students. What is that? Cross allergy. Now, what do I mean by a cross allergy? The cross allergy, I mean to say that if person is allergic to penicillin, that means he is high likely that he is allergic to cephalosporin also. This type of allergy is only called as cross allergy, and the same way cross resistance also work. If the bacteria is resistant to one antimicrobial agent, that can be resistant to another microbial, then we call it as a cross resistance. Same way, one antimicrobial agent, the person is having an allergy, the other one also he'll get allergy, called as cross allergy. If resistance also same way, then we call it as a cross resistance. Okay. Now my dear students, after you understood about cephalosporins, the cephalosporins again they're used for gram positive. Okay, then they're used for cocci, and they're available both in the form of tablets, they're available in the form of injections. They're also used for one more infection called as bacteroids. Okay, once we understood about that, let's go to the next aspect. What is that? Guys, remember, after you gave a beta-lactam antibiotic, now bacteria, will it keep quiet? Now bacteria, it will not keep quiet. Bacteria will produce an enzyme called as beta lactamase. It will produce an enzyme called as beta lactamase. Now this beta lactamase break the beta lactam ring. So if it break the beta lactam ring, automatically will your antibiotic be useful? No. For that purpose only, what we can do, my dear students, we can inhibit. What is that? That is your Okay. We can inhibit. That is your what is that? That is your most important aspect. That is your beta lactamase inhibitor, such as clavulanic acid. Apart from the clavulanic acid, we have one more drug that is called as tazobactam, my dear students. What is that? Tazobactam. Now, tazobactam and clavulanic acid, they're used for what? A combination with what? Combination with other antibiotics. antibiotics. Other antibiotics, which antibiotics? Of course, beta-lactam ones. Of course, beta-lactam ones. Okay. Now, you people might have noticed one classic example you might have found. That is your, what is that? Amoxicillin. Amoxicillin plus clavulanic acid. Clavulanic acid. This combination is only called as, we call this combination as augmentin. Augmentin. Okay, so what is an augmentin, my dear students? This is your augmentin related story. Now, apart from that, my dear students, I want you to understand some of the most important aspects related to these antibiotics. That important aspect, once we are done with that, then we have one more type of antibiotics. What are those type of antibiotics? Let's see. So, we learned about vancomycin, we learned about cephalosporin, we learned about inhibitors. Then we have one more thing in the cell wall synthesis inhibitor called as azithromycin. Remember these names, that is enough. Azithromycin. Okay, streptogramins also fall in this case. Streptogramins also fall here. Then apart from that, we have one more type of antibiotics called as carbapenems. What is that? They're called as, my dear students, carbapenems. Carbapenem. Okay, now carbapenems. This carbapenem will fall. Carbapenem. Apart from that, we have carbapenems. We have drugs. What are those drugs? We have drugs such as meropenem. Meropenem. We have one more drug called as imipenem. Imipenem. And dorepenem. What is that? Doripenem. These are some antibiotics to be remembered. Okay, now once you know about this, let's go to the next important aspect of antibiotics. They are called as protein synthesis inhibitors. Protein synthesis inhibitor. Now, protein synthesis inhibitors, they are what type of antibiotics? Usually, they are a type of bacteriostatic antibiotics. They are your bacteriostatic antibiotics. Now, when you want to understand about the bacteriostatic antibiotics, what are the bacteriostatic antibiotics we have? We have the antibiotics which will inhibit 30S subunits. So, these 30S subunits of ribosome. So, ribosomes are responsible for what? Protein synthesis. If you inhibit the 30S subunit of a ribosome, automatically the bacteria will not be able to do the protein synthesis and bacteria will not be able to replicate. So, stop the growth of the bacteria. We call it as, what is that? We call it as what is that? We call it as one of the most important ones called as 30S subunit and protein synthesis bacteriostatic inhibitors. Okay. So somebody says, what is that? Macrolides. Very good. Macrolides does not come under 30S subunit inhibitor. Rather, macrolides come under a 50S subunit inhibitor. Got it, my dear Ishan? Okay. Okay. So let's look here. Okay. Now, what do we have? We have a drug called as aminoglycosides. We have drugs called as aminoglycosides. Aminoglycosides. Now, aminoglycosides. Can anybody tell me some aminoglycosides? The aminoglycosides, we have drugs such as gentamicin. Okay. Apart from gentamicin, one more antibiotic I want you to remember, that is your streptomycin. What is that? Streptomycin, gentamicin and streptomycin. Okay. Now, this gentamicin, streptomycin, okay. Thank you. Now, look here, gentamicin, streptomycin. Why these two drugs I'm focusing? One of the most important question here is that ototoxicity. Ototoxic drugs. What is that? Ototoxic drugs. Ototoxic drug means toxic to your inner ear. And one more thing, this ototoxicity is also caused by one more drugs called as loop diuretics. What is that? Loop diuretic. Okay. Now, streptomycin is what? It is a type of second line injectable anti-TB drug. Injectable anti-TB drug is a type of injectable anti-TB drugs. Okay. Now, apart from this 30S subunit inhibitor, next group of antibiotics we have, that is your tetracyclines. What is that? Tetracyclines. Now, what are these tetracyclines? Tetracyclines are very important ones. Tetracyclines are widely used for what? Vector-borne diseases. For what? Vector-borne diseases. For vector-borne diseases. Okay, for the vector-borne diseases, we are going to use the tetracyclines. Tetracyclines such as, we have a drug such as doxycycline. Doxycycline, okay. Apart from doxycycline, we have a drug called as demiclocycline. What is it? Demiclocycline. Then apart from that, the direct drug is there, that is called as tetracycline itself. Okay, so these are the three antibiotics we have. But the most important aspect, my dear students, demiclocycline earlier used for your, what is that? Earlier used for SIADH. Okay, earlier used for what? Syndrome of inappropriate ADH production, but now we don't use it. Rather, we use a V2 antagonist called as Vaptans. V2 antagonist called as Vaptans. Okay, now aminoglycosides. See, calcium channel blocking effect is this. There are other effects which are very non-significant when you're looking at an aspect of a exam-oriented point of view. Okay, especially in a MCQ point. Now, tetracyclines, where we use, we know, vector-borne diseases. But there are some important factors. They're contraindicated in which patient? In the children and pregnant female. If you use in the pregnant female, if used, what will happen? If used, baby will develop, what are the problems? Baby will develop problems such as, that is yellow tooth and skeletal defects. So same problem, because of the skeletal defect, we avoid them in the children also. Okay. All right. Now, once you know about tetracyclines, let's go to the next group of antibiotics. Clear about aminoglycoside part here? Okay. Now, let's go to the next aspect. What is that next aspect? The drugs which inhibit the 50s subunit of the ribosome. The drugs which inhibit the 50s subunit of the ribosome. We have drugs such as macrolides. Okay. Now, apart from macrolides, we have another drug called as slindamycin. Apart from that, we have drugs such as linezolid. So all these drugs, linezolid, all these drugs are what? They are your, what is that? 50s subunit inhibitor. So macrolides such as your azithromycin, clarithromycin. Now these antibiotics are widely used for respiratory tract infection. Okay. Now linezolid is a type of reserved antibiotic. We don't just use it for every patient, but linezolid is rather reserved antibiotic. Okay. Then we have erythromycin. This is a very important antibiotic. Why? I'll tell you. Because erythromycin is a type of antibiotic which is safe in children. And also erythromycin interact with the can anybody tell me interact with the one of the most important drug, that is your thiophyllin. Interact with which drug? Thiophyllin. This is a story of your 50s subunit inhibitor. So after protein synthesis inhibitor, we have drugs such as DNA synthesis inhibitor. So DNA synthesis inhibitor, the classic drugs we have fluoroquinolones. What is it? Fluoroquinolones. Now, when you are talking about fluoroquinolones, these fluoroquinolones are very important ones. Why? You'll understand there are so many important and interesting MCQs related to this also. Okay. Now, when you want to understand about the fluoroquinolones, my dear students, fluoroquinolones, drugs such as ciprofloxacin, then there is ofloxacin, then there is levofloxacin. Okay, then there is one more drug, moxifloxacin, which is not widely available in India. Okay. Now, fluoroquinolones, my dear students, fluoroquinolones, their mechanism of action is very important. What is the mechanism of action of fluoroquinolones? They inhibit DNA gyrase. Now, DNA gyrase of human or a bacteria, DNA gyrase of the bacteria, DNA gyrase of the bacteria. Okay. Now, the uses, they're used for many conditions, many infections. One of the infections you can remember, in cholera also we can use this drug. Okay. Now, but the most important aspect is that this ciprofloxacin is called as urinary fluoroquinolone. Urinary fluoroquinolone. Levofloxacin is called as respiratory fluoroquinolone. Levofloxacin is called as respiratory fluoroquinolones. Means for the respiratory infection we prefer levofloxacin, and for the urinary infection we prefer ciprofloxacin. And there is one MCQ which is being frequently asked in all the exams, that is the side effect. The side effect caused by these drugs are your tendinitis. Tendinitis. Now, tendinitis occurs in which type of population? In the children. In the children. If you use this drug in the children can develop the tendinitis. That is a side effect which can be caused as a result of, what is that? As a result of using of this drug. What is that drug? That is fluoroquinolones. Okay. So, this is the important aspects which are related to your one of the antibiotics. What is the topic? Antibiotics. So, this is the most important things which you need to learn from the antibiotic in the topic, in the point of view as a revision. Now, let's go to the next aspect. The next aspect is anti-cancer drugs. My dear students, listen to me very carefully. Anti-cancer drugs are one of the important one, but how do we learn anti-cancer drug? So please don't remember anti-cancer drugs. The uses from pharmacology, because the uses of anti-cancer drugs is wide range, not just something like, okay, some small aspect, okay, 1-2 lines are there, it will get over. Not like that. The anti-cancer drugs are combined used, means there are some drug regimes, there are some drugs combination has to be used. Okay, there are some newer agents. So all these things might vary, but there are some pharma related, very very important MCQ related aspects which I want you people must know. Let's learn about those. Okay. Now, anti-cancer drug, along with the classification, I'm going to discuss the drugs also. We have anti-cancer drugs. So all these anti-cancer drugs act on where? Act on the cell cycle. Usually act on where? Cell cycle. So in the cell cycle, in different stages, they will act. But one of the first and most important drugs we have called as alkylating agents. Alkylating agents. Now, in this alkylating agents, we have many drugs. What is that alkylating agents? So, in the alkylating agents, my dear students, we have drugs. The drugs such as one of the most important called as cyclophosphamide. Cyclophosphamide. Now, when you're talking about cyclophosphamide, listen to me very carefully. This cyclophosphamide is such a drug. Cyclophosphamide is such a drug. It will cause one side effect. It will cause one side effect. The name of the side effect is called as hemorrhagic cystitis. Hemorrhagic cystitis. So, the most dangerous side effect of cyclophosphamide, one of those side effects which is frequently asked, is your hemorrhagic cystitis. So, the treatment for your hemorrhagic cystitis induced by your cyclophosphamide is called as Mesna. Mesna. Okay. Very good. Called as Mesna. Okay. Now, please listen to me. This cyclophosphamide is such a type of drug which will cause hemorrhagic cystitis because of its toxic metabolite. The toxic metabolite. Why hemorrhagic cystitis occurs? Because acroleon. Acroleon is a type of metabolite. This metabolite causes hemorrhagic cystitis. The next important drug which is there here, that is called as melphalan. Then we have one more drug called as chlorambucil. Okay, so these drugs are your, what is that? That is your alkylating agents. In this, there is one more drug, my dear students, that is only called as busulfan. Now, this busulfan will cause one side effect, that is your pulmonary fibrosis. So yesterday I told you people one drug causes pulmonary fibrosis. What is that? Amiodarone. Along with that, you need to remember this one. What is that? This is your busulfan. Clear everybody? So once you understood about this, the next important group of drugs which I want to discuss are anti-metabolites. Anti-metabolites. Now what are these anti-metabolites? Now these anti-metabolites are a group of drugs which is having inhibition of cell cycle, but from a different aspect. What is that different aspect? The first and most important one we have called as a folate antagonist. Folate antagonist. Basically, listen to me very carefully. If your cell has to synthesize any DNA, any RNA, for that you require a folate. That folate, if it has to come from folic acid, if it has to convert into folate, it requires some stages. It requires some stages. For that we require one enzyme. What is that? Dihydrofolate reductase. Dihydrofolate reductase. Now, dihydrofolate reductase is inhibited by your drug called as methotrexate. Methotrexate. The mechanism of action of methotrexate is what? Inhibition of dihydrofolate reductase. Okay. Now, this dihydrofolate reductase is inhibited. The methotrexate is very much myelotoxic drug. It is a type of myelotoxic drug. There are uses of methotrexate. Uses of methotrexate, it is used in multiple places such as rheumatoid arthritis. Rheumatoid arthritis. There are some skin autoimmune conditions. Skin autoimmune conditions. Of course, in the cancer. Of course, in the cancer. Okay. Now, apart from that, there is anything else? Thank you. Then, is there anything else? Yes, there is one more aspect. This methotrexate is used during, what is that? Ectopic pregnancy. During the ectopic pregnancy. See, ectopic pregnancy might require surgery, but there is one determining factor, level of beta HCG. Based on the level of beta HCG, if it is lower level, we can prefer methotrexate also here. Okay, clear? Okay. Okay, let's continue to the next aspect. The next important aspect, what is that? Once you understood about that, there is one more aspect. What is that? Purine antagonist. We have something called as purine antagonist. Purine antagonist. Now, what is this purine antagonist? Now, this purine antagonist, my dear students, the drugs such as 6-mercaptopurine. Mercaptopurine. Okay. Apart from 16-mercaptopurine, there is one more thing. What is that 16-mercaptopurine? And there is one more drug called as azathioprine. Azathioprine. Okay. Azathioprine and your 16-mercaptopurine. Everybody able to follow? Okay. So, now, once you know about this azathioprine and 16-mercaptopurine, then we are going to go to the next group of drugs, that is pyrimidine antagonist. Pyrimidine antagonist. Pyrimidine antagonist. Now, this pyrimidine antagonist drugs, we have few drugs. What are the drugs we have? We have a drug called as 5-fluorouracil. 5-fluorouracil, and there is one more aspect to it, that is only called as cytarabine. What is that? Cytarabine. So these are the two drugs which you need to remember from, what is that? From the pyrimidine antagonist. Okay. Let's go to the next important drugs. What are those, my dear students? See, the drugs, next group of drugs. There are lots of drugs here. You are not going to remember everything at one go. Okay. So one go, but you can remember them with the time. Okay. Now let's go to the next important drugs. They are called as Vinca alkaloids. Vinca alkaloids are your plant derivatives. These are the alkaloids. The drugs are vincristine and vinblastine. Vincristine and vinblastine. Now, vincristine, vinblastine are widely used, but one of the uses I can tell you is rhabdomyosarcoma. It is also used for rhabdomyosarcoma treatment. Okay. Now, my dear students, we have one more important aspect. In the human, we have topoisomerase. Topoisomerase. topoisomerase 2 inhibitor. We have a drug which is inhibiting the topoisomerase. The name of the drug is called as etoposide. Etoposide. What is that? Etoposide. You can look at it as, you can look at it as topoisomerase inhibitor. Topoisomerase inhibitor. Here. Okay. Now, apart from that, my dear students, the next important drugs, the antibiotics. There are some antibiotics with anti-cancer property. Now, since they are having a nice anti-cancer property, we use them directly for anti-cancer treatment itself, such as adriamycin. Apart from adriamycin, then there is one more drug, that is mitomycin. Then there is one more thing, mitomycin C. There is one more thing called as doxorubicin. Now this doxorubicin is a very important MCQ, because they will ask a question, what exactly is the dangerous aspect to it? This doxorubicin is a type of cardiotoxic drug, guys. Cardiotoxic. What is the drug? Cardiotoxic drug. Okay. Now, apart from this, there are some other drugs. Other drugs, please understand, we have drugs, that is platinum derivatives, you can call it as. These platinum derivatives, all of them will have drug name platin in them, that is such as cisplatin. We have one more drug called as carboplatin. Now these platinum drugs, the side effects, they are very much, since it is a heavy metal derivative, they are nephrotoxic, my dear. What is that? Nephrotoxic drugs. They are your nephrotoxic drugs. So this is the important aspects which you need to remember related to anti-cancer drugs. Okay. Now apart from that, in the cancer we use other drugs. What are the other drugs which we use in the cancer? The drugs which are related to hormones, especially in the gynecological cancer, such as GnRH agonist, and there is one more hormone related, that is 5-alpha reductase inhibitor, which I already taught you people, that is finasteride. Clear, everybody? So with this much being said, we will conclude the class here. Okay. Hope the pharma revision was useful for you people. In a span of 10 to 12 hours, I have tried to given you the complete overview of the pharma, and I have given you the most important high yield MCQs. Okay, so if you learn and remember all the antibiotics, all the anti-cancer drugs, all the, for example, endocrine system, and for example, all the important points in all the topics, just important points which I highlighted, even if you remember them, you should be able to solve most of your questions. Most of your questions will be solved from here only. This much I can assuredly guarantee you people. All right. See, this much is sufficient. See, once if you have studied, yes, for revision, it is sufficient. In the time span you have, if you have, there is about 1 to 1.5 months. This is sufficient for you. All right. Is there anything you want to ask me? Let's see if you have anything else to ask. So if you don't have anything else, see you people in the next upcoming sessions. Thank you so much. Thank you so much for being with me, for paying attention, and see you people next time. Bye-bye. Thank you.